I want you to imagine something for a moment. You've done everything right. You retired on schedule. You enrolled in Medicare on time. You picked a plan. You thought you were covered. And then one day, a bill arrives. Not a small bill, not a copay, a real bill, for thousands of dollars. For care you thought Medicare was paying for. And when you call to find out what happened, they tell you Medicare doesn't cover that. It never did, and nobody told you. This happens to retirees across America every single day. Not because they made bad decisions, not because they chose the wrong plan, but because there are specific gaps in Medicare coverage that almost nobody talks about. Until the bill shows up. Today we're pulling back the curtain on every single one of those gaps. The things Medicare flat out does not cover. The costs that blindside people in their first year of retirement. And exactly what you can do right now to make sure this never happens to you. Stay with us, because some of these gaps are going to shock you. Welcome back to Medicare Exposed, the channel that exposes what the Medicare industry hopes you never find out, before it costs you thousands of dollars. No commissions, no plans to sell, no agenda. If this is your first video with us, hit subscribe right now. Let's get into it. Let's start with the single biggest shock. The one that catches more retirees off guard than anything else. Dental care. Original Medicare, Parts A and B, does not cover routine dental care at all. No cleanings, no fillings, no root canals, no extractions, no dentures, nothing. Now you might be thinking, wait, I've seen Medicare Advantage commercials promising free dental coverage. And that's true. Some Medicare Advantage plans include limited dental benefits. But as we covered in video 5, Medicare Advantage comes with its own set of traps and restrictions. And even the dental coverage included in most Advantage plans is limited. Basic cleanings and exams, yes. Major dental work like implants, crowns, and complex procedures, often not covered or severely limited. According to the American Dental Association, the average American retiree will spend over $1,000 per year on out-of-pocket dental expenses. Over a 20-year retirement, that's $20,000 in dental costs that Medicare will never touch. If you need major dental work, a full set of implants can run $30,000 to $50,000, and Medicare will pay exactly $0 of that. This is not a small gap. This is a massive financial exposure that most people walking into retirement have no plan for. Gap number 2, vision care. Original Medicare does not cover routine eye exams. It does not cover eyeglasses. It does not cover contact lenses. If you need a new prescription, you pay out of pocket. If you need bifocals, you pay out of pocket. If you need progressive lenses, you pay out of pocket. Now, Medicare does cover certain medically necessary eye procedures. Cataract surgery, for example, is covered under Part B. Diabetic retinopathy exams are covered for people with diabetes. But routine vision care, the annual exam, and the glasses or contacts that follow it, is not covered. Full stop. The average pair of prescription eyeglasses costs $300 to $500. An eye exam runs $100 to $200. For a couple, that's potentially $1,000 a year in vision expenses that Medicare won't touch. Gap number 3. And this one surprises almost everyone. Hearing aids. Original Medicare does not cover hearing aids. It does not cover hearing exams for the purpose of fitting hearing aids. Hearing loss affects roughly 2/3 of Americans over the age of 70. It is one of the most common health issues in retirement, and Medicare pays nothing for it. The cost of a quality pair of hearing aids ranges from $2,000 to $7,000 per pair, with a lifespan of roughly 5 years. Over a 20-year retirement, you could spend $8,000 to $28,000 on hearing aids that Medicare will never reimburse. Pause on that for a second. The 3 things most likely to affect your quality of life in retirement, your teeth, your eyes, and your hearing, are the 3 things Original Medicare flat out refuses to cover. This is not an oversight. This is how the program was designed. Gap number 4, long-term care. This is the gap that genuinely terrifies financial planners, and for good reason. Medicare does not cover long-term custodial care. What does that mean exactly? If you need help with daily activities, bathing, dressing, eating, moving around, either at home or in a facility, Medicare does not pay for that ongoing care. Medicare will cover a limited stay in a skilled nursing facility after a qualifying hospital stay, but only up to 100 days, and only under very specific conditions. After 100 days, you pay everything out of pocket. The average cost of a private room in a nursing home is over $100,000 per year. The average length of a long-term care need is 3 years. Do the math. That is a potential $300,000 exposure that Medicare will not cover a single dollar of. This is why long-term care insurance exists. This is why Medicaid planning exists. And this is a conversation every person approaching retirement needs to have before they need care, not after. Gap number 5. Overseas travel. Original Medicare does not cover medical care received outside the United States, with very limited exceptions. If you retire and travel internationally, if you're a snowbird spending winters in another country, if you take a cruise that enters international waters, Medicare is not protecting you. You will need separate travel health insurance. This catches people off guard constantly. They assume Medicare travels with them. It does not. Gap number 6. The 20% with no cap. We touched on this in video 3, but it deserves its own spotlight. Under Original Medicare Part B, Medicare pays 80% of approved costs after your deductible. You pay the other 20% with no out-of-pocket maximum, no cap, which means if you have a serious medical event, a heart attack, a stroke, a cancer diagnosis, a major surgery, your 20% responsibility can run into tens of thousands of dollars. On a $200,000 surgery, your 20% is $40,000, out of pocket, with no limit. This is why Medigap supplemental insurance exists, and this is why the decision between Original Medicare with Medigap versus Medicare Advantage is the most important financial choice you'll make at 65. So what do you actually do about all of this? Here is your gap closing action plan. Step 1. For dental, vision, and hearing, look at standalone supplemental insurance plans. Companies like Humana, Cigna, and Delta Dental offer standalone dental and vision plans that are completely separate from your Medicare coverage. Costs range from $30 to $80 per month, depending on coverage level. Also, look at discount dental networks like Carrington or Dental Saves. For routine care, these can cut your costs by 20% to 50%. And if you're considering Medicare Advantage specifically for the dental benefits, make sure you actually read what is and isn't covered in that plan before you enroll. Not the commercial, the actual plan documents. Step 2. For the 20% gap in Original Medicare, enroll in a Medigap supplemental plan during your guaranteed issue window at 65. We are covering Medigap in complete detail in our next video, but the key message right now is this. If you want Original Medicare's freedom with a financial ceiling on your out-of-pocket costs, Medigap is how you get there. And you must enroll at 65 during your guaranteed issue window, because waiting puts your eligibility at risk. Step 3. For long-term care, have an honest conversation with a financial planner about long-term care insurance. The earlier you buy it, the cheaper it is. Waiting until your late 60s or 70s significantly increases the premium. And waiting until you have health conditions may disqualify you entirely. This is not a fun conversation, but the alternative, spending $300,000 out of pocket on nursing home care, is significantly less fun. Step 4. For international travel, purchase a travel health insurance policy anytime you leave the country. Policies are available for as little as $50 to $100 per trip. Some Medicare supplement plans, specifically Medigap Plan G and Plan N, do include limited foreign travel emergency coverage. So if you travel frequently internationally, factor that into your Medigap plan selection. Medicare is powerful coverage, but it was never designed to be complete coverage. The gaps are real, they are significant, and the people who get blindsided by them are almost always the ones who assumed Medicare covered more than it does. You just spent the last 10 minutes making sure that never happens to you. That knowledge has a dollar value, and it's a big one. If this video helped you, hit subscribe and turn on notifications, because next week we're covering Medigap, the supplement plans that fill these gaps. and exactly how to choose the right one without overpaying $1 more than you have to. We'll see you there.